Hey all, I'm Venus Singh, a health coach at Sugarfit. Today, I wanted to discuss some of the basic diabetes terms that I feel that you all should know. So start getting into the subject of diabetes and blood sugar, and you may feel like you have been speaking another language. When you have diabetes, understanding your numbers as well as your options for self-management will help you live a very healthy life. Here, I will tell you some basic terms associated with diabetes so that you should understand them when you're interacting with your health coach or your doctor. So glucose is the main source of energy that food is turned into, and it's found in our blood. It is created by the body whenever you eat food. Blood glucose levels are the amount of glucose that someone has in their blood at any given point of time. It is measured in mg per dl, which is milligrams per deciliter. Normal blood glucose levels for adults without diabetes who haven't eaten for at least 8 hours, which is called as the fasting window, it's supposed to be less than 100 mg per dl. A normal blood glucose level for adults without diabetes 2 hours after eating is less than 140 mg per dl. As the name suggests, a glucose meter or a glucometer is a simple device used to determine the approximate concentration of glucose in the blood. This small device has a screen attached to it that shows the blood sugar levels digitally, and all you need to do is insert a test strip in the device, prick the finger with a lancet and put a drop of blood on the test strip. The device will then calculate the levels in milligrams per deciliter, which is mg per dl. Keeping a log of your results on blood glucose chart will give you an excellent picture of your body's response to your actions and your care plan. Hyperglycemia, that means high blood glucose, is a condition where there is too much sugar in the blood. High blood sugar can have causes that aren't due to underlying disease. Examples include recent consumption of a high carbohydrate meal or medication side effects. It also occurs when the body does not produce or use enough insulin, which is a hormone that absorbs glucose into the cells for its use as energy. High blood glucose or high blood sugar is a leading indicator of diabetes. Hypoglycemia is also known as low blood sugar. It is a fall in blood sugar levels to levels below normal. The most common cause of hypoglycemia is medications used to treat diabetes, such as insulin or sulfonylureas. Symptoms include feeling excessive hunger, sweating, shakiness, or weakness. These symptoms may typically come on very quickly. Therefore, it is important to understand the hypoglycemia symptoms and how to treat it correctly. Commonly known as rebound effect, the Somogyi effect is a condition in which your blood sugar gets very high after it has been really low. The phenomenon usually occurs when you wake up after sleeping for a very long period. In case it occurs very frequently, you might need to keep a check on your blood glucose levels in midnights as well. As recommended by experts, the Somogyi effect can be prevented by having a light snack in the evening or by adjusting your sleeping time. Just below and behind your stomach, there's a small gland about the size of your hand. This gland is termed as the pancreas. The gland is responsible for producing insulin. It has a group of cells known as islets. These islets produce hormones and various digestive juices that help you break down the food that you eat. Its beta cells produce insulin and its alpha cells produce a hormone called as Glucagon. Insulin is a hormone that helps the body use glucose. Insulin allows glucose to enter the cells that need it, especially the muscles. Without insulin, glucose can't get to where it needs to go. People with type 1 diabetes don't have this hormone in sufficient quantities, and people with type 2 diabetes either don't have it or their bodies are not able to use it due to resistance to insulin, which is also called as insulin resistance. An insulin pump is the device you might need to carry next to your body. It comprises of a thin tube connected to a needle that goes beneath your skin. The device keeps giving a trickle of insulin all day long to maintain a healthy blood sugar. It can be easily programmed as per timings and the insulin level. Glucagon is another hormone that's secreted by pancreas apart from insulin. It works the opposite of insulin. It is responsible for raising the blood sugar levels. However, insulin is responsible for controlling or reducing the blood sugar levels. It's actually a condition wherein your cells don't respond as well as it should to the insulin hormone. So, insulin hormone is released by the pancreas and it's supposed to let the glucose enter the blood cells. That's its main function. But when we develop insulin resistance, the cells don't respond as well as it should to insulin. It's an early sign of type 2 diabetes and it's usually associated with prediabetes, obesity, high cholesterol levels, and high blood sugar levels. Prediabetes is a condition in which the blood sugar is higher than the normal range, but not high enough to be labeled as diabetes. This condition is often experienced as a warning sign before developing type 2 diabetes. Gestational diabetes is another type of diabetes that develops in pregnant women. This disease usually gets cured after giving birth to the child. Experts say that if you have been diagnosed with gestational diabetes, you are more likely to develop type 2 diabetes in the future if you don't take care well of yourself. It is another type of diabetes in which your sugar levels change rapidly from high to low. When suffering from this condition, it is hard to control your blood sugar levels. This kind of diabetes results from medical condition or medical problems in your kidneys or pituitary gland. In this kind of diabetes, you might have normal blood sugar levels, but you may feel very weak and highly thirsty all the time. This is often referred to as diabetes. It's a medical condition in which your body faces trouble using up glucose for energy. This can be classified into two types. Type 1 diabetes is a condition when your body destroys the beta cells that produce insulin. Type 2 diabetes mellitus is a condition when your body can't use the insulin properly.